Hello, guys. Welcome to episode 6. This episode is going to be a bit different, right? We have gathered questions that we have received from people all over the world, right, who want to know, right, what I'm going to ask Dr. Buleni today. But before I ask her, we just want to check up on her to see if she's doing great and all is well with her. How are you, Dr. Buleni, and is everything good on your side?
Hi, hello, hi everyone. I am well. Thank you for asking. Hoping everyone is well out there. And thank you
Mm.
for tuning in.
Yeah. Yeah. Before we start, don't forget to like, comment, and subscribe, because we want to continue this thing of teaching people about dental health, oral health. And the only way we can do it is if we grow. And by growing, the only thing you guys need to do is subscribe, like, and comment in the video. If you have a question or if you have anything to say about what we're speaking about, even if you have a question that we didn't ask, you can ask it below in the comments and we will make sure that we get back to you and answer you. Dr. Buleni will personally give me that answer to give to you as well. So don't worry, we're not going to use AI to answer your questions. Anyway, Dr. Buleni, the first question I have for you is, why is fluoride toothpaste healthy for the teeth? Because we know that people talk down on fluoride. They say it makes you dumb and all of those things. Is it really that bad? And how is it helping the teeth then? Why do people demonize it so much?
Honestly, I have no idea why people are demonizing it so much. However, I am pro fluoride because it helps to
Mm,
remineralize the teeth, thus making the enamel stronger because you have to make sure that your enamel is stronger to fight against the acidic attacks or the sugary attacks from the food that we eat. So I'm pro
mm,
fluoride. I would say continue to use your fluoridated toothpaste. If you're a bit scared of it, then I'll say probably then alternate it. Have two toothpaste, the one that has fluoride and the one without fluoride. But at least have some
mm.
fluoride in your routine of your oral health care regime. Just make sure that you put in some fluoride there, strengthen the enamel, remineralize the enamel from all the acid attacks from all the food and drinks you are having throughout the day.
Mm. Yeah, and speaking of toothpaste, like which brand in South Africa would you say is the best, like, with toothpaste? Because I know most of our listeners will probably be South African, so I'm sure that's also a question that they always have for themselves because we know there's these type of toothpaste and these types, but which one would you say this one is top tier quality? Maybe name your top three, you know?
Um, okay, in terms of the high fluoride content, we have
Mm.
Clean Pro. Clean Pro, you can only get it at your dentist office. It has the highest amount of fluoride. We normally give it to people or prescribe it to people who
Yes, subscribe, guys.
yeah,
Subscribe.
subscribe.
You heard it.
Prescribe it to people who have rampant caries, who have multiple teeth that are rotten, people who
Mm,
are compromised, immune compromised patients, or patients who are compromised physically, disabled, what's this? Um, Differently able people, and also people who are starting with the braces because they tend to have difficulty brushing properly their teeth. So I'll always prescribe that toothpaste. It's called Clean Pro. We have it at the practice. And then for general use, I use Colgate Total because it has just sufficient amount of fluoride. It has an antibacterial agent, triclosan, and for me it smells nice and fresh. And besides, I grew up using it, and I'm acquainted to the taste. But more than anything, that's what I use. That's what my family use as well.
mm. Yeah. And I wanted to go a little into um smoking and drinking, right? So I'm sure you've met a lot of patients that have, you know, bad teeth because of one of those two, but which ones would you say is the worst? And which one can you say, okay, this is not too bad? Would you say smoking or drinking alcohol ruins your teeth?
Yeah. Let's see. Okay, I'll just explain what they both do to your teeth, and then you can decide whether they are bad or good.
Fair.
Okay. The first one is with the smoking, the nicotine has an agent that prevents the blood from clotting. So thus, if you have any bleeding in your mouth, yeah, or if you've removed a tooth, or you have a
Mm-hmm.
scar, then it takes longer to heal because of the nicotine agent that prevents the gums, the blood to clot and then thus close properly. So that's what it does. And obviously, people who smoke most of the time, they'll have inflamed gums. That means their gums never really heal because every day they keep on smoking and just introducing that nicotine to the gums. With the
Mm-hmm.
alcohol, we have different contents of alcohol with high acidic content. So I think with the alcohol, it's a similar example as the one I did with the chocolates or the refined carbohydrates. It's not the amount of alcohol or the refined carbohydrates or the sugar that you eat. It's the duration that you take while drinking that. So if you are the person who, when they drink, they switch their mouth with the drink. Obviously, you'll be more susceptible to acid attacks because alcohol is acidic. And also, if you keep on continuously drinking for the next 30 minutes, obviously there will be an acid attack on your teeth. But if you, let's say, you have your drink within 10 minutes, you're done, and then you drink water, then obviously you've neutralized your pH in your mouth. Then you'll be less susceptible to caries or cavities.
Mm-hmm.
So that is my answer. So you decide which one is better. You know, which one
Okay.
is which one is the most destroyer or not? Yeah.
Yeah. Honestly, I think it's smoking. I think smoking is bad. Because it also, affects how your breath smells and all of that. So that is, yeah. For me, I would rather drink than smoke. But anyway, we all have our
Yeah.
choices.
Yeah. I mean, that's your choice. I can't blame you. But what I think I can say also about smoking is because it's gonna stay. The smoke is gonna stay. Not the smoke. What when you smoke, the
Yeah.
agent with this covers your tongue. And then it covers your tongue.
Mm.
It prevents you from tasting the food properly. And obviously, people who smoke a lot tend to put more salts or more spices just to make sure that they're able to taste the food because
Oh.
of the tongue that is being covered by all the biofilm or the bacteria from the normal bacteria of your mouth and also from smoking. And obviously, most of the time,
Mm.
when they try to clean their tongue, they'll tend to hurt themselves because it's much dirtier than the person who doesn't smoke. And with the bleeding, then it takes
Mm.
longer for them to heal as well. So it's just a cycle that keeps on, happening. And besides
Yeah.
staining your teeth, then. So yeah, I mean, also coffee people stain their teeth, but coffee and smoking and vaping. Smoking and vaping is the same thing. So you can't say because I'm vaping is better. It's the same thing.
Yeah. I know a few coffee people.
Oh, well, I'm one of them. I'm having my coffee right here. But my tea are fine.
Oh, quality, even
Yeah.
whiter than mine. So yeah, respect that.
Yeah.
Um,
Yeah.
so the next question I would have is, we know that water is obviously a good drink for your teeth, but what else do we know about that's a great drink because with food, um, you can point out to things with calcium like spinach, I think, and all of that that can help the teeth. But with drinks, I don't think we know pretty much about other than water, which drink can also help your teeth. So mind shedding some light onto that?
Yeah, there's nothing superior to water. Water is the most superior in terms of health, in terms of hydration, in terms of hydration, in terms of taste, in terms of refreshment. I mean, water is up there. But
Mm,
then I know that, for an example, Woolworths have their water is called alkaline water,
yeah.
alkalinized water. So
Mm,
if you want to have an alkalinized water, if you don't have a filter, water filter at home, or those jugs that filter water that you can buy at Macro, and you know,
yeah.
you can also just put a pinch of bicarbonate of soda because bicarbonate of soda is alkalinic. Just a pinch and then allow it to dissolve and drink it. Don't brush your teeth with it. Allow it to dissolve,
Mm.
then you drink it. So you just add it to your water. But water is the superior drink you can have for your teeth, for your mouth, for your skin, for refreshment. It's the most ultimate luxury I can say. Just water.
Yeah.
Nothing else, yeah.
Yeah, no, true. So for the last question, I would like to take it back to just being South African, right? So we're both South African, uh, proud South Africans, by the way, right?
Are
So
you,
we
are you sure we both South African? I might be British, you never know.
who knows? Who knows these days, eh?
Yeah.
Yeah. Um, I might be British. Yeah, so in South Africa, we have a culture of basically if a child's tooth is loose, we'll get a string, tie that string around the tooth and pull it and all of that just to take the tooth out. Like, as a dentist, like, do you actually recommend that culture? Would you say you can do it, or is there actually some risk to it that parents or elders or whoever does it to like children or even themselves, like are there any dangers that they might not know of, or is it a safe thing to do and we must continue this culture?
First of all, I'm not that South African. Then we talk about that. I'm not South African enough.
Okay, she's not South African enough, guys.
Then I'm not South African enough because I really don't believe in that. I also didn't
Mm,
grow up in such an environment where parents would do that. These are the cultures
mm,
and the myths that you learn as you are in the field as well. So I know a lot of people do it, and I've seen quite a number of people on social media doing it.
mm,
The risk obviously is that you might fracture the roots or break the roots of the tooth. But normally with the baby teeth, the root most of the time is already resolved. But in instances where the root is not really resolved, then that's the risk I think they are facing themselves with. Two, I think it's trauma. Like it's just listening to it is traumatic. And then thirdly,
it
you lose
is.
the patient, okay, you lose the child's tooth, and then where is the child gonna get the tooth fairy's money when the tooth has just flown out through the door and the cut and because you first tie the tooth with the whatever string, they normally use the floss, and they put the thing
Mm.
in the floss on the door, and then they close the door roughly. What if the tooth just flies over and then you can't find the tooth? The child will be mad at you because they're relying on the tooth to have the tooth fairy give them money. So that's what I'm saying.
Yeah.
I'm South African enough.
Yeah, yeah, perhaps because I know a person who literally tied, like, he has a toy gun that springs like out this other sponge bullet, you can say. So what he did was tie the string to that spongy bullet that springs out once you shoot,
Yeah.
and then he tied it to the child's teeth, and then took a video of it. And then
Yeah.
once he pressed that thing, it's like comes out with it.
No, no.
So
That sounds like something that a dad will do, or a brother, or an uncle, not
he
a
was
mother.
definitely a dad. He was
Yeah,
definitely a
yeah.
dad.
Not a mother. I don't think any mother would do that. It sounds like a boy's kind of adventure.
Yeah, true. Anyway, this was a great episode. I hope you guys learned a few things about British culture and South African
You
culture,
know?
as we're trying to mix a few cultures and it be inclusive, as they call it, right? I hope you enjoyed this, and please like and subscribe and comment and share this with, you know, South Africans or British people. And I hope they do enjoy it. Any last word, Dr. Buleni?
No, thank you so much for joining in. Any suggestions, please, how we can make our videos more relatable to you? Any questions? DM us, DM me, write in the comment section. We really appreciate them.
Yeah. No, thank you so much, and see you guys on the next episode.
Bye.